Have you ever been in a therapy appointment with a client and had this thought, is this actually helping them? And so, on this episode of Love, Happiness, and Success for Therapists, we are diving into this so that you can leave with some clarity around how to tell the difference between effective therapy that really is moving the needle versus maybe some wishy washy therapy that isn't. I am Dr. Lisa Marie Bobby. I myself am a licensed psychologist, a licensed marriage and family therapist, a board certified coach, and I'm also a clinical supervisor of other therapists. And I think we can all totally relate to that experience of wondering, is our work really helping our clients? As you know, if you've listened to this podcast before, being a therapist comes with many occupational hazards, right? And I think much of this is related to our relationship to the work itself. For example, by definition, as therapists, we are often dealing with a ton of ambiguity. Additionally, therapy often involves subtle, gradual changes that are slow. They are not immediately visible either to our clients or to us. In fact, it can take months or sometimes even years for some of the positive growth that we're working on with our clients to really manifest itself in their lives. And frequently by then, you might not even be working together anymore. Additionally, the changes that our clients are experiencing are frequently very internal. They are lived experiences and they might not show up as different behaviors in the world, especially not for a while. And then lastly, as you so well know, there is not one right way to do any of this, which I think leaves all of us therapists sometimes wondering, am I doing it right? If you often struggle with this type of ambiguity as a therapist, today I have a bunch of tips for you to help you know if you are actually helping your therapy clients or if it's time to course correct. We all need the satisfaction of a job well done in order to feel good and motivated about our own work. And I think especially true for therapists like us who care so deeply about helping other people. This is the mission, right? And so we need to know when we are not maybe on the right track so that we can course correct and always be sure that the way that we're working with our clients is truly in service of them. We need to have reliable ways to measure our clients' progress because that helps us adjust the work to meet their needs. Also, do some growth ourselves, like maybe is there a growth opportunity? Could I be doing something differently as their therapist? And that is the kind of care and thoughtfulness that doesn't just help our clients, it also helps us become better therapists across our career span. One of the first and most important things that you can do with every single one of your therapy clients is to first, at the outset of their work, help them set clear goals so that they're talking explicitly in words what they want to get out of this, why they are here. It is critical that you can both articulate this because without goals, there is no way to measure progress and you won't know if it's working or not. There is an art to goal setting. Goals that help you measure outcomes need to be measurable by definition. They also need to be achievable and specific, and certainly tailored to each client's needs, hopes, and desires. Then, as therapy progresses, these goals can also evolve, which in itself can actually be a sign of progress, because changing goals can indicate that your client is moving. They are gaining deeper insight into their values, their desires, their challenges, and they are evolving. Therefore, so are their goals. Another super important thing all therapists should be doing with their clients is to have regular regular check-ins about how things are going. Regularly checking in with your clients about their perceptions of their progress can provide you with very direct feedback on what they're getting out of their therapy sessions, how they perceive their progress, and also telling you where they might need a different approach. This kind of direct questioning not only helps you assess your client's progress and evaluate their evolving needs, but it also helps you build a stronger and more trusting relationship with your clients because they feel safe giving you feedback. This can go such a long way in preventing therapeutic ruptures or having your clients feel like they're not getting a whole lot out of their work with you. Another simple but very powerful way of making sure your clients are in fact getting something out of this is to keep an eye on their behavior changes, because changes in your client's behavior outside of the room as well as inside of the room can serve as tangible evidence of therapy's effectiveness. So listen to their stories. You might hear them talking about feeling more productive at work or feeling like they're going somewhere at work, having a different outcome in their relationships, like conversations are going a little bit easier all of a sudden with their spouse, or you might hear them talking about taking care of themselves in better ways. And all of these behavior changes can be signs that your client is definitely making progress. It can be so easy, and this happens to all of us therapists, for a client to just sort of sit down and start sharing about how they're feeling and what's going on in their lives without necessarily giving you specific information that would help you track their progress. So it's absolutely to be in the moment with your client talking about whatever they need to talk about. That's great. But be sure to ask. You were having such a hard time with time management recently, and then we talked about that a few sessions ago. How's that going these days? So it's part of your job to make sure that your clients are benefiting from this work, and you asking these kinds of assessment questions is a big part of how you do that. In particular, you want to be listening for these success stories where clients are telling you that they are using the new skills that you've been talking about in your sessions, practicing the new ideas or mindsets that help them feel better, and telling you that it is working. So when they come back into sessions, telling you stories about how they applied new coping strategies or communication skills in real life situations, that is a clear sign that they're getting something out of this. This can look like so many things. Skills like more positive self-talk, feeling more confident about handling conflict, or maybe even setting healthy boundaries in their relationships can all reflect progress in therapy. So, goal setting, periodic check-ins, and observing changes are all excellent strategies for knowing whether or not your work with them is effective. Now, another success marker, believe it or not, other signs that it's working can include graduation from therapy. When our clients are doing well, sometimes the most apparent sign of progress is when a client no longer needs our support. And that is fantastic. When a client can, independently manage their own issues and use the tools and skills that you've helped them develop, that is such a powerful testament to the effectiveness of your work. I know it can be hard letting a therapy client go or even encouraging them to spread their wings and fly. It is bittersweet, but it is always the ultimate goal of therapy is for our clients to not be dependent on us, for them to learn and grow and evolve and go on independently of us to have better lives because of the work that we've done with them. In order to do this, you absolutely need to be keeping track of their progress. Now, I will also tell you, just super full disclosure, that the skills and strategies I'm teaching you about how to be a more effective therapist are not actually coming necessarily from counseling psychology. psychology. They are coming from coaching psychology. If you've listened to me on this podcast before, you know that I am a huge advocate of coaching psychology and therapists learning how to coach, not just to be coaches, but actually to grow into better therapists who get better outcomes with their clients. The strategies we've just been talking about, goal setting, progress tracking, having check-ins, making sure that your clients are moving forward, these are all ideas that come from evidence-based coaching psychology. It is outcome-focused, it is genuinely helpful to clients, it is positive, and more than anything else, coaching is productive in a way that I think sometimes our mandate as therapists does not always require us to be operating at that same level. That can be a little bit hard to hear, but think about it. Unless you are doing a clear treatment plan and you only get a certain number of sessions to help a client move from A to Z, especially in private practice, it can be very easy to fall into these patterns of unstructured, unfocused talk therapy where your client comes in every week, tells you what's going on in their lives, and then walks out the door. Rinse and repeat. This is great for, getting insight into yourself or having a positive, supportive person in their lives, but it is not the same thing as necessarily as helping them create real and lasting change. Therapists are not exactly needing to do that. The relationship is what it's about, and generating insight is not always the same thing as generating results. So if you are a therapist who has struggled with some of the ambiguity that we've been talking about, particularly around traditional person-centered talk therapy, it might be worth exploring and learning about coaching psychology because it will offer you a more structured alternative that is focused on clear, measurable goals and also provides you with a framework for assessing your client's progress. This process and knowing how to do this can be deeply satisfying, both for you and your clients, whether or not you are operating as a therapist or as a coach. Concrete objectives and direct feedback mechanisms that are really inherent to the coaching process makes it easier for you to do all the things that we've been talking about today, including knowing how to set clear, measurable goals, knowing how to facilitate check-ins that are really about progress, and then lastly, being able to focus on making changes to your own process to make sure that what you're doing in the room with your clients is genuinely in service of what they want to create through their work with you. If you are interested in developing these professional competencies, I have a brand new resource that I am so excited to share with you. It is really a crash course in what is coaching psychology and could it be right for me as a therapist. This is a brand new, totally free two-part training called Coaching Certification for Therapists, the Ultimate Guide. And in this training, I am helping you create a vision for your ideal career path, like where you want to go with all this, but then also competencies of a coach and walking you through a series of exercises that allow you to make decisions about whether or not this is something you want to learn more about and apply in your own practice. Again, I am such a huge advocate of coaching. I feel more than anything that it has personally helped me be a better therapist, and that's something that I care very deeply about, and I know you do too. That is why we're all here, is to be of benefit for our clients. And so I hope that hearing this new information about how to really know if your therapy clients are progressing and the specific specific tools and strategies that you can be using in order to get that clarity into their growth process. I hope that that was helpful for you. Additional free resources, if you come to my website, growingself.com/therapists, you can find additional podcasts that will help you up your game as a therapist, but also have more fun doing it. These podcasts are all about lowering your stress, increasing your love, happiness, and success, because you matter too. We're not doing anybody any favors if we're grinding ourselves into a pulp and flaring out, right? So this podcast is all about you, and I have a ton of free resources on my website for you. So podcasts, articles, interactive activities, and of course, grab that free workshop that I was telling you about, because whether or not you decide to become a coach, you will still have the benefit of walking through exercises that will help you clarify your own professional goals and help you create an action plan that will help you achieve them, whether or not coaching is in your future. So definitely get that. Thank you so much for spending this time with me today. I'm glad you were here, and I'll be back in touch next time with another episode of Love, Happiness, and Success for Therapists.